is Jennifer, and I'm an RN student at Brennan College. I'm going to be doing an assessment on you. Is that okay?
Yeah.
Can you tell me your name?
Walter Martin.
Do you know why you're here?
Stabbed a cop. I don't know.
Do you know who the president is?
Joe Biden.
How old are you?
29.
And what year is it?
2022.
So the patient is A&O times 4. And just by the general appearance, I know that he is well groomed. I know that he has a normal cephalic head, and I don't see any lesions on his, or any drainage coming out of his eyes, ears, nose, or mouth. Okay, Walter. So I want you to know that this is a safe place, and I'm going to ask you some questions. Over the past couple months, have you had any stress?
A little bit. Shh. I know what I'm doing.
Do you see something?
No.
Do you hear something?
Yes.
Do you know its name?
His name's Hannibal.
Can you tell me about Hannibal?
He's a voice I hear sometimes. He tells me to do bad things.
When was the first time you met Hannibal?
About 2 weeks after my doctor prescribed me Abilify.
How were you feeling how were you feeling at the time with the new RX?
I was feeling great. I'm not supposed to drink with it though.
Do you drink alcohol?
Sometimes when I'm stressed. I've noticed Hannibal's not around when I drink.
Do you hear him right now?
Yes.
What's he saying to you?
Nothing much.
Does he tell you any methods or specific plans?
Sometimes.
Have you intended on acting out any of Hannibal's plans?
No, just when I stabbed the cop.
Okay. Do you have any thoughts of suicide, past or present?
About a year ago.
That's a 9. Anyways, do you have a plan?
No.
Are you on any medications?
Yeah, Abilify.
Are you on any other medications? No. Do you know why you're on Abilify?
For schizophrenia.
Do you keep track of your medication regimen? Do you take the medication as prescribed?
I forget sometimes.
Are you currently up to date with your immunizations?
I believe so.
Are you sexually active?
No.
Okay, thank you, Walter. You help me understand a little bit more about what's going on. Now I'm going to do a head to toe. Okay, so feeling the Bruce, bear with me. Okay, so feel my head. There's nothing in the head. There's no lesions. In the ear, there's no drainage, just a whole bunch of earwax. Facial features, no drainage, like I said earlier. I'm looking at his skin, and at this time I would also feel his skin for the warmth. Do my cap refills, as well as make sure that the integrity is within range. Now, what I'm going to do, I got a light. Okay, I can still see me. I want you to look at the light, and don't move your head, just follow the light. Perfect. All right, now I'm going to look at your pupils, so there's going to be a bright light in your eye. Perfect. And of course, he would be in a gown, so I'd be able to better assist him. But for right now, this is what we're doing. I'm going to listen listen to your heart and your lung sounds as well as your bowel sounds. Might help if it's on. Bruce, I listened for 1 full minute. Heart rate, bowel sounds, and lung sounds are all clear. While I was listening to his lung sounds, if this was a true, patient, I'd ask him to lean forward and listen to his posterior lung sounds. Do you have any trouble urinating? Any pain? Any nausea, vomiting, diarrhea? When was your last bowel movement?
Yesterday.
When was the last time you drank alcohol?
Yesterday.
Oh, okay. So do you poop whenever you drink alcohol?
Yes.
Okay. Now I'm assessing his legs, making sure that there's no lesions, bumps, bruises, making sure his skin integrity is within limits. Also checking his cap refills, checking the plantar, or the thingamabobber that you hit the leg with. You know what I'm talking about, Bruce. And then with all that, I also assessed his cranial nerves. Buster, am I done? Am I done? Did I forget anything?